Hi guys, I wanted to shoot a little video on a great simple test for knee pain, okay? So we have our our patient here that has knee pain, and you've had knee pain for, I think you told me, like about 3 weeks. So it's been bothering her, so I'm going to show you what to do, okay? You might be able to do this on yourself, or you might be able to find someone to do it on you, but I'm just going to show you how it works. So the first thing is go ahead and stand up, okay? And kind of squat down until that knee hurts. Okay, good. Okay, so have a seat. So I guess it wasn't quite at a 45 degree, but it was, when she comes down, this is weak. Okay, so what we want to do is we want to check the flexors on the legs. So there's these couple muscles. You have the quadricep femoris, right, on both sides, and then you have a muscle inside into the hip called the psoas. They're hip flexors. They allow the leg to come up, right? So first thing, I'm going to bring this knee as high as you can. Okay, resist me. Okay, so this one's really strong. Okay, let's do the same thing. Resist me as strong as you can. Okay, it's weak. So this leg is really weak. This is really strong. What's going to happen, it's going to create an imbalance. It's not going to be symmetrical. So when she walks, this leg's going to drag a little bit, creating wear and tear on this knee joint. Okay, so this could have happened from a fall. Who knows? I mean, we're not going to get into that. But I'm just going to show you a quick thing to make it strong and improve the pain, okay? So if it's weak on this side, we're going to work on the opposite side. And we're going to stimulate this muscle. Now, it's going to be really tender in here, so just let me know if it's too much. Now, you could probably do this with the massage tool and really get in there and work on the quadricep on the don't work on this side. Work on the opposite side, right into the hip, okay? There's about 4, quad means 4. You have this muscle here, you got an inside muscle, you got the outside muscle right through in here. And you're just going to massage and really work out the knots through here. It's going to be very tender. And you can go on the outside too, come right through in here, right up into the hip. So this muscle, and this muscle, okay? So you work on that. So I just did a tiny little bit. Make sure you go all the way up to the hip. Okay, so now what we're going to do is we're going to recheck this right here. Bring it up. Resist me. That's strong, okay? So now you might be saying, oh, I'm not pressing hard enough. Well, you just do it on yourself or have someone do it on you, and you'll see that it will get strong like that, okay? So now I'm going to have her stand up and just bend down and see if it's any better. Cool, great. So have a seat here. So that was less pain? Yeah. Awesome. So it's a really simple test and quick fix that you can do on the quadricep. Always work on the opposite side. So the reason why it works is both of these are connected on a circuit. The thigh bone's connected to the hip bone, right? And neurologically, you can work on this side to affect this side. Go ahead and try it out and put your comments down below. Hey, I appreciate your attention, and if you're enjoying these videos, go ahead and subscribe, and I will definitely keep you updated on future events, live events, and webinars that we're going to do very soon.